again, and these are the Republicans who are saying no or maybe to the bill. Nevada's Dean Heller is insisting that the new bill will not lower premiums. Also on the no side, Senator Ted Cruz from Texas. And I want to talk to Chip Roy now. Chip, you used to be the chief of staff for Senator Cruz. Tell me what you think it would take for Cruz and others who are more conservative there, who are in the no column, to move to yes.
Good afternoon, Anna. Well, frankly, to actually honor their commitment to repeal Obamacare. That fundamentally is the core problem that conservatives have with the bill that's been put forward in the U.S. Senate. And any member of the U.S. Senate that goes home to their constituents and actually looks at them and says that this bill repeals it would simply be lying. And frankly, that's why they're not going out and having town halls and going and trying to talk to their constituents, and instead they're trying to jam it through in a short week. Because they recognize that the people back home are looking at this and saying, this isn't going to do anything to lower my premiums. This isn't going to do anything to improve my care. All I'm hearing about are tax cuts and slush funds for insurers. And that's not what they've been promised for the last 7 years.
So you think this is a giveaway to the wealthy?
Well, look, I think that the tax cuts in the bill are important. But fundamentally, at the core of the bill, you've got to get rid of the regulations that are driving up the costs. And there are people across the political spectrum, Republican and Democrat, who recognize that if you're going to have regulations involved with Obamacare or whatever replacement they just put in place, those regulations are driving up the cost. The CBO recognized that, as you pointed out about the House bill. The CBO pointed out that premiums are going to go up significantly and continue to go up over time. The only break that they got was in states where there might be a waiver where they could get out from underneath the regulations that are driving up the costs. That's what the American people have been looking for. Premiums have doubled under Obamacare. And for the American people, that hits them right at home in the wallet. And that's what they're trying to get their leaders in Washington to actually do.
I want to ask you about one of the sticking points, at least for some of these senators, Medicaid. It's a big one for many Republicans who have chosen not to support the bill, who are more moderate in particular. Let's look at how many people are covered by Medicaid. We know this is the Medicaid program, not just the expansion. It covers 70 million Americans. In fact, 49% of all births, 2 in 5 children, 3 in 5 nursing home residents make up that 70 million American number. What is the political calculus for Republicans to pass a bill that potentially impacts and gets rid of a chunk of money that would otherwise support millions of Americans who rely on Medicaid?
Well, you pointed out at the outset of the show, I think, that with respect to Medicaid, the cuts that they're talking about are really just reductions in the expansion. And in fact, the GOP bill, actually, from a conservative standpoint, it continues to expand Medicaid for 6-7 years out into the future. And that's part of the problem. And I think the GOP is picking a bad fight, because what they're going to do is they're going to be labeled for cutting Medicaid, but they're going to get no benefits from anybody for actually changing the regulatory structure so that you can get premiums to go down. The only way to get good health care is to do that. I know I keep coming back to that, but that's at the core of the problem. Medicaid's going to continue to expand, but the GOP is going to get hit for getting cuts because they're reducing the increases, as you, I think, observed at the beginning of the show.
Right, and reducing those increases, we're hearing from governors, Republican governors like John Kasich, it would in effect leave some people who currently have Medicaid out of being eligible. How might that result in, I guess, let me rephrase the question, if Medicaid isn't going to pay for those low-income groups, who does?
Well, I think one of the problems you have is that if you look at Obamacare, and when President Obama would talk about 20 million Americans being insured under Obamacare, the fact is 14 million of those were on Medicaid. And the problem you have is in a state like Illinois, which expanded Medicaid. We did not in Texas. You have so many people on the waiting list because so many people have been jammed into the Medicaid rolls that you have people actually dying waiting for care in Medicaid in Illinois. That's what we're going to be facing in this country if we continue to jam millions of people into Medicaid rolls. The only way to free up the system is to get regulations out and do what we suggested at the Texas Public Policy Foundation. Let's flip it. Let's have an opt-in. And if states want to get into Obamacare, turn it back around and let governors choose to opt into the Obamacare highly regulated system. But let's set the baseline in an unregulated system. And if you want to reform Medicaid, great. But we shouldn't pass a Medicaid reform bill and call it Obamacare repeal, which is what the GOP is trying to do.
All right, Chip Roy, thank you so much.
Thanks, Anna.
A silent civil war